Hello, welcome to this hip mobility video. It's going to be approximately 10 minutes long. Before you begin, if you have any concerns about injuries or if you experience pain throughout, please stop and seek medical advice. So we start lying down on the back, knees bent, feet flat to the floor, rest the spine down, lengthen the back of the neck, and take a moment to settle into this position. Just noticing how the body's feeling. Noticing the area of the pelvis, noticing the hip joints, each leg, feeling the soles of the feet placing downwards. And we're going to begin by drawing the right knee into the chest, and the left leg could remain bent as it is or lengthen if you prefer. Begin to circle the ankle. Releasing any pops or cracks that might occur at the joint. And this is usually the pops and cracks are something called fixation, which is where tissues get sort of stuck together. So as we mobilise, as synovial fluid flows, change directions if you haven't already, the fluid helps to release any stuckness in the joint. And then pause with the ankle and begin a similar type of movement with your hip. Circling in a slow and controlled motion. Choosing how large you want these circles to be. It could be very small, it could be a little bit larger. It could gradually begin to grow with the range of movement at the hip joint. The hands could be supporting, keeping the foot quite close to the hips so there's no undue pressure on the core or the hip flexor muscle, the psoas at the front of the thighs, front of the hips. And again, changing your direction. And as much as possible, isolating the movement at the ball and socket joint of the hip, but without too much concentration on this. So there might be a little bit of movement around the pelvis, but the focus here is on hip mobility, so trying to stick with the ball and socket joint as much as possible. And after your next circle, pause and then lengthen the leg up, maybe holding onto the back of the thigh if that's comfortable, or using a tea towel or a towel around the thigh if the arms don't feel they've got enough length. And the knee could be a little bit bent if you prefer. And begin a little shake of the ankle. And then allow the knee to feel a little bit softer. And allow the shake now to come all the way up the leg. Starting to stimulate blood flow, energy flow, waking the leg up. And then when you're done, hug in one more time. Feel the length over the back of the right hip, the back of the psoas muscle, it flows from front to back. And then drawing your right leg over to the left, right shoulder blade stays down, the left hand supports the thigh, easing the stretch. And the right foot could rest on the thigh, on the floor. You could place a block or a book or something underneath to support the leg. And rest here in the stretch, in the pose. Allowing the breath to be comfortable. Taking the mind to the hip and notice how it's feeling. Perhaps concentrating on the sensation of the water element or flow. As we've mobilised the ankle, the knee, the hip, started to release synovial fluid at the joints, lubricating the joints, allowing more ease. You're welcome if you wish to hold for longer and pause the video. And when you're ready, into centre. Press the foot down. Take a moment in the original position, feet to the floor, knees bent. Settle downwards and notice if you feel a difference between the two sides. And then switching, hugging your left knee in, lengthening the right leg or keeping it bent, whichever you prefer, and a circle of the left ankle. And ankle mobility is really important. So it stimulates the calf muscle as you move the ankle. And the calf muscle is sometimes known as the second heart. It encourages deoxygenated blood to flow back to the heart. And change your direction. And it also acts as a pump for the lymphatic system as well. So the lymph that flows through the body, the liquid that flows through the body to get rid of toxins, doesn't have its own pumping system. So the calf muscle here, this stimulation here around the calf area helps to help the lymphatic flow in the lower body. And then pause with the ankle and take the movement to the hip, circling your left hip, ball in the socket, noticing how it's feeling, how the movement flows, or whether it's feeling a little bit clunky in places. Observing the quality of the circle. Is it easier to open the hip? Does it feel like there's some resistance? And always working within your edge. It's not going in too far, just to the right spot. And then change your direction, developing mobility without any stress or strain at the joint. And taking one more circle. And then draw the knee in again. Thigh towards chest. Bring a little shake to the foot. Any sort of movement will do. There's no right or wrong here. Allow it to come into the knee. Very gentle with the knee. Noticing how it's feeling. And maybe all the way up to the thigh and the leg. And shake the entire leg out. Encouraging an alertness, aliveness within the leg. And then when you're done with the shake, draw the knee in once more. And then take the left knee over to the right. Left shoulder blade stays down. Left foot could be supported on a block or something like that. And notice how it feels to lengthen over the outside of the left hip. Twisting through the spine. Leaving space between the vertebrae. And bringing your awareness to the quality of water. Healing and soothing qualities of water around the hip, the lower back. And positions like this that twist through the lower body, or the previous position where we had the knee hugging into the chest, can be really good for digestion as well. So stimulating the gut as the thigh presses towards the lower belly. There's a massage there for the internal organs. On a physical level, but also on a mental and emotional level, helping us to digest our thoughts and our feelings, experiences that come and go. And as with the other side, if you'd like to hold for longer, you're welcome to pause the video. When you're ready, coming back into centre. And place both feet onto the floor again. Settle the spine. Lengthen the back of the neck. Notice how the legs are feeling, how the feet are feeling, how the hips are feeling. ready, bring both knees into the chest and have a gentle rock from side to side, or a circular movement, maybe even a figure of 8. Change your direction of your circling while doing the figure of 8. Massaging into the lower back. And then when you're ready, bring the knees over to the right, left hand onto the floor in front of the face. Lengthen your left leg, press through your left hand, come up to the seated position, and we're all finished. Thank you very much. Namaste.